Hi, everyone. I am Tylor Maria, and I am a senior policy and data analyst at Policy and Practice. During my portion of this packed presentation, I'll be kicking off with a bit of an overview about what we've seen from 2022, or even before that with the pandemic, especially with respect to rises in household debts. That will provide a nice backdrop then for understanding the reasons why this conversation that we're having today is so important. And also provide a backdrop for the aims and the objectives of the debt research project that my colleague Zoe and I did over the past year. In this project, we uncovered two main findings that I'll be sharing with you. The first are about the drivers of the journey into household debts. And the last portion that I'll be sharing with you before I hand it over to Kath are 4 different council-led interventions to best support vulnerable households. Overall, this portion of the presentation will help to provide a backdrop for the different presentations that Kath and Gary will be speaking about, and provide a bit of human color about the lived experiences of the ways that people found themselves into debt, and the different ways that you can help to support these households in financial crisis. Next slide. So first, to kick off, we've seen that debts have risen during the pandemic and slowly crept up, and by mid-2022, we found that households took on a third more debt than their income. And on top of that, we find the cost of living crisis hot on the heels of the pandemic, and this prompted an increase in the number of clients who sought support from debt advice charities. Statistics from the ONS reported that 94% of adults saw an increase in the cost of living by November 2022, as we saw CPI inflation rise, and increases to households' budgets for food and energy costs. All of that had risen by November 2022. We also found that 14% of households said that they were using more credit than usual to cope. If we contextualize this picture within the UK, we find that problem debt costs the UK £8.3 billion through the damages it causes to family life and the stresses it puts on relationships. It causes damage through to mental and physical health. It changes or impacts productivity and employment perspectives, as well as it imposes very large costs to the welfare state, NHS, local government, and other agencies. Research by Step Change shows that using credit to cope with financial difficulties compounds problems, and people often struggle for too long before they access help. Now, one of the lines that Policy and Practice really tries very hard to put out there and to raise awareness, if you haven't heard this harrowing statistic, is that not only adjacent to this issue that we see with the rise in debt, we see tons more households increasing their use of credit and not knowing that there is support out there. But this goes right alongside the fact that the government has provided billions of pounds of support each year, yet an additional 19 billion pounds of existing benefits goes unclaimed each year. This is huge. And this is why it's so important to have this conversation today, and for all of us to think of the ways that different frontline organizations and councils can support residents who are waiting way too long for help in financial crisis. And many households don't necessarily know to put their hands up for support. So it's very, very important to have research and to have ongoing debates about the ways to target households in financial need. Next slide. So to kick off my portion of the presentation, I think it's very important to talk about some of the debt research that we've done at Policy and Practice. So over this past year, my colleague Zoe Charlesworth and I did a project where we were commissioned by one London borough to understand how residents had fallen into debt. Now, this project was mainly comprised of qualitative interviews with 20 residents who had fallen into debt within the last 2 years. And you can boil down the main objectives of this research into 2 main areas. The first was that this project sought to understand, how did these households find themselves into debt? What was their journey like, and what were the main factors that drove them into these financial situations? And the next portion of the research was to understand the different ways that the council could help to prevent debt for other residents and support these residents currently in their financial crisis. Now, as I go through this, as I go through some of the findings with this presentation, I think it's important to realize that this project helps to provide a like lived experience and human color to some of the facts and statistics that we'll be speaking about, where Gary will be highlighting some of the ways that councils can use data to target households, and Kath will be talking about victims of loan sharks and what the profile looks like. And my portion of the presentation will provide a bit of color to some of the facts presented about some of the drivers of debt and the short and long-term impacts of debt on households across within this one local authority. Next slide. So this is a word cloud that we took from listing the most common reasons why households found themselves falling into debt. And without even diving into it right there, you can see just based on all of the different words there and the sizes of the words that the journey into debt is varied. Income, which often is a very large, one of the main reasons why people find themselves into debt, is not the only reason why many of the households find themselves in their current financial situation. So based on the word cloud, you can see that the reasons that are the largest are the ones that are most frequently mentioned within the interviews. So you can see here, the most common reasons listed are the cost of living crisis, illness, unemployment, COVID, in addition to other things like immigrations and visas, bereavement, rises in costs, and benefit issues. To boil this down, many households have cited that the rise in the cost of living, so rises in household goods such as food or energy prices, led to many households finding themselves relying on credit and going into debt. We also found that major life changes, income shocks, for instance, finding themselves with physical illness, disability, or changes in their mental health also led them to fall in further into debt and accumulate more arrears. We also found that residents mentioned things like unemployment or job redundancy as some of the major shocks that led them to fall into debt. Benefit issues or delays in receiving their benefit were also cited frequently within these interviews. And this also goes in addition to other smaller factors that were mentioned, whether it was like the loss of a loved one, changes in relationship status, or domestic abuse. Next slide. So this is a case study to highlight how some of the factors that I just mentioned, how they work together. And it's quite a very important point to anchor some of the findings that we'll be speaking about in this presentation. For many clients, for many of our residents that we interviewed, and for many people in households that find themselves in debt, there's a complexity of these factors. There's a multi-layering of the reasons why a person finds themselves in a vulnerable or precarious financial situation. And it's a layering. It's not just the one person finds themselves without enough income or their income is reduced, but oftentimes this comes coupled with changes in physical health. This comes coupled with strains on a personal relationship. This comes coupled with benefit issues. There's a complexity to some of the factors that drive households into debt. So this is just one instance or one case study that we found within the research. And it begins with COVID and the lockdown. During the pandemic, both the interviewee, she gets sick, and her partner gets sick. And this leads to, for the main interviewee, who is self-employed, their small business collapsed. And for the partner, they become unemployed. So this leads to the household income becoming severely reduced. But this is also coupled with the partner developing poor mental health and depression. And because of that, that limits their ability to navigate and to respond to financial crisis. So for instance, when the council posted letters informing them of their CT arrears, the partner suffering from depression hid these letters because they're unable to cope with the information that was there. And just in general, unable to cope with all that was going on. And the partner doesn't engage with the council. When the interviewee actually founds the council tax arrears letters, they're unable to actually to address any of these because CT liability is not in their name. So you can see, and you can see this in the picture with the long arrow that goes alongside the bottom of the image. This leads to the further accumulation of arrears in debt. All of this compiles together. Now, due to some of these issues that we mentioned here, specifically around the household income being severely reduced, the partner then goes to claim benefits, but encounters a few issues in the process of claiming the benefit that delays them actually putting in an application and them receiving an award. And I've listed some of them out, but it's quite important to note that lack of engagement is quite an important one, and that is related to the partner's mental health issues. In addition to issues with CT liability and who's actually responsible for council tax, immigration issues are also coupled on top of that. So there's quite a lot going on in this. Long story short, the couple then there's an intervention where Citizens Advice appointed a lawyer to help resolve some of the tenancy issues, the immigration issues, and the benefit issues that arise. And this family then gets a benefit award. But their late application means that this family is living on very little income for months. So this leads to the further accumulation of arrears in debt. But then once they actually receive the award, the level of benefit is actually quite small due to them under occupying their property. So this compounds and creates a very large financial situation that the household has to deal with when we go to speak to them. So long story short, not to say that this is a generalizable case study, but to highlight the fact that not everyone's debt journey is going to be unique, but oftentimes you'll find with certain debt cases, there is a complexity and a multi-layering of factors that creates this situation of a household getting into tons more of arrears and debt over time. And understanding that is actually quite crucial for then figuring out, for instance, in Kath's line of work and what she'll be speaking about later in the presentation, who is the person, what does this household unit look like that might fall victim to loan sharks? But in terms of identifying solutions, and Gary will touch upon this more when he speaks, this helps to highlight some of the ways that this household might be picked up in data and can also inform the ways that we can target support and communicate support to a household like this. Next slide. So for the remaining part of what I'll be speaking on, I'll be speaking about the specific solutions that we identified within the interviews. The first of which is to make the first debt-related contact count. It was quite important, as mentioned by residents, that that first point of contact when the council reaches out to them ought to be a good one. So first, using an appropriate method of ongoing communications. So many residents actually preferred getting a phone call rather than a letter, or a text rather than a letter, as it was easier to actually, see what was going on, but it was just a bit easier for the clients or the residents to engage. In addition to that, many residents talked about improving the written and verbal communication skills of the council. So in particular, having a friendly outgoing message, a supportive outgoing message, rather than one threatening of enforcement practices or threatening for eviction. It was a lot better oftentimes if the first communication was a friendly one. And lastly, contacting residents at the earliest possible instance of arrears. So rather than waiting for lots of letters and all these things to pile up, or lots of debts to pile up, contact the resident at the moment that they missed their first payment rather than waiting. Next slide. The second intervention identified in the interviews was to develop customer-focused services. So many residents highlighted that having a customer-focused hub to meet the needs of the vulnerable residents was quite important. So having face-to-face contact with one named caseworker who was their advocate was quite important for many residents. They felt that many of them said that it was quite challenging to recount and rehash some of their very touching and challenging stories about how they had fallen into debt, and would have appreciated, for instance, having just one person that they can develop a relationship with over time, and have one person actually be an advocate for them and help to show them the way out of debt. Many of these residents felt like that would have been a very helpful and preventative way that they could have been supported by the council. This method is also quite well formative and useful because it could help provide more holistic and specialized support, especially for complex households like the one that I had referenced in the case study. Support like this, where there's just one named caseworker, could help to contextualize all of the pressures that one household unit was facing. And to that point, in order to do this, data sharing between departments and agencies during life-challenging events such as bereavement, such as changes to someone's relationship status, data sharing between departments or agencies could be quite helpful in order to get a larger picture of what's going on with the household unit, and then to actually target support to them at the right time. Next slide. The third intervention that came out of these interviews was to inform residents about council support. Interestingly enough, majority of the residents had mentioned that they did not see the council as the supportive agency. So it was quite important that the council start to provide clear and direct messaging that the council is there to help. And from conversations with the residents and with those who were at this London Borough, there were many ways that this could actually be done, and the diversity of ways is actually quite important. So the first was having step-by-step instructions on how residents can take action on their debts and arrears. For many of the residents who, let's say, didn't necessarily have the capacity to cope or didn't know how they would actually make a way out of their debts and turned off because of that, actually having written out that you could have a repayment plan and this is what you needed to do was quite helpful to encourage them to take action on their debts and arrears. In addition to that, some residents had asked for workshops on budgeting and income maximization, as many of them might not have known how to budget and how to maximize their income. For instance, benefit entitlement checkers could be quite a powerful tool, and us at Policy and Practice have one, and there are many other ways that people can figure out how to budget and what different ways and what support is out there that they could use to help make their needs. In addition to that, council support such as pop-up shops, pamphlets, leaflets, and flyers were also quite helpful as well. And most importantly, having very clear signposting and very clear help at the forefront of a council website. So for instance, having a very clear page that says, we are here to help with all of the available support that the council has to offer, and signpost to other available areas of support as well was quite useful. Next slide. So this is just a snippet from one of the interviews that we have, just demonstrating that. This person says, giving a layout, an overview, and maybe not so many papers, maybe videos. Sometimes things land more in videos. And also highlighting what people are entitled to when they do face difficulties. I know they just say, oh, just go to the website, but some people can't always access the website. So just making these things more accessible. As I hinted at earlier, having a diversity of ways to highlight that there is support out there, that we are here to help you, is quite helpful for encouraging people to take up what's out there, to take up that 19 billion pounds of support that goes unclaimed each year. Next slide. And lastly, and this point I think Gary will take home as he presents later on today, is using data to identify households with the capability to pay and engage with the council. So it's quite useful to use administrative data to identify vulnerability in debt collection and enforcement policies. So you can use administrative data, for instance, to greater segregate debtors that cannot pay, those who cannot engage, or those who won't pay. And you can use this to then consider different ways of tailoring contact activity based on their vulnerability. So for some people, for instance, having a bit more support, having clear-cut step-by-step instructions is the best way to help them move forward. But for others, different ways of contacting them might actually be more helpful based on the characteristics of the household. And you can use data to identify this, for instance, in our low-income family tracker platform. And lastly, using data, you can then identify cases that are unlikely to achieve recovery and push specific cases for the writing off of their debts. Gary will go into this further, but administrative data is one really powerful way that you can actually target households for support and encourage them to take up what is out there. Next slide. Next slide, and this is my last slide. So overall, from our project on Debt with One London Borough, we've highlighted that there are many reasons why families fall into debt, and this can lead to long-term damages into household health, well-being, and employment. However, there are different ways and different council-led service transformations that can support vulnerable families, such as changes and improvements in communication, improving signposting to help, and using administrative data to segment debtors. I've just written a blog sharing the work that my colleague Zoe and I have done. The link is in the slides, which will be sent to you after this presentation.